Hello, ladies and gentlemen, and welcome to Triple N Talk Show. I am Dr. Nick Nikam, and today I am going to be talking with Dr. Ashok Jain, who is a psychiatrist practicing here in Sugar Land, Texas, and he has a special gadget which he's going to talk about. Ashok, it's a pleasure. We are delighted to have you.
Thank you, sir.
And the last time you were on our program, we had this marathon session on Marathon 101. So let's switch gears and talk about psychiatry. Tell us a little bit about your practice, and we'll talk about TMS, a special instrument that has great potential.
Sure. Thank you. Thank you very much for inviting me, Nick, and thank you very much for seeing this. I'm like last time we talked about, I finished my marathon, but we are going to talk today about psychiatry. I'm the board certified psychiatrist. I'm board certified in 4 different boards, and we have one of the largest practice in Houston and Sugar Land area. We have 5 different clinics in different location, including Sealy, Katy, Pearland, Lake Jackson, as well as our headquarters in Sugar Land. And we have patients from all walk of life, and we have whole complement of different professionals, including nurse practitioners, psychologists, therapists, and we have alliances with different. So needless to say, we treat all kind of disorders from all different age groups, starting from 2-year-old and going to 95-year-old. And after 95, I tell them that I will come to your home, if I need to. Because when I see my patients first time, our gold standard is, we tell them, we always actually tell them that we treat you like our own family, or that's our gold standard. There should not be anything different than my own family getting the care what you should receive from me or our practices. So we try to give a very concierge-like, very family-like, very good, humane, nice standard of practice. Now we treat. I was noticing that there were different practices in Houston. They were not able to advance to the next level. And then couple of practices started a treatment called transcranial magnetic stimulation, which we are going to talk today about. So, but the problem with the TMS was that it was beyond ordinary person's reach. Insurances, nobody took insurances, and as of my knowledge, nobody is taking insurances. So I was wondering why our patient need to suffer. So we brought that technology to a common person's reach. And very soon you will be pleased to hear that we are the largest TMS provider in the whole Texas. We have 6 machines now in a different corners, in different areas, where we are. It is a very affordable for the patient to, and it's a very costly treatment, but it's a life-changing treatment, and we can introduce to our clients, our patients, and common people.
That's fascinating. Ladies and gentlemen, you are watching a Triple N Talk Show, and all our programs are video streamed through YouTube and also Google Plus. And please do subscribe to our YouTube channel, where we have more than 2,500 subscribers and 1.5 million views. We also have a Facebook page, which is a Triple N Media, where we bring you the latest buzz from around the world. And we would like you to please do like our Facebook page. Okay, let's talk about transcranial magnetic stimulation. What is transcranial?
I'm sorry.
Let's start with the alphabets.
word is too long. You're right. It looked like some alien galaxy spaceship is coming. But the principle is very, very simple. So transcranial means that cranium is skull. So trans means across the skull. So
you're not cutting anything.
No, well, we joke with the patient sometimes. We are going to poke needles in your head.
Yeah, that's what I was wondering.
No, actually, this is exact replacement of what used to happen, the neurosurgery. So before, what used to happen was, let me step back a little bit. As we know, you have seen a lot of this. Our brain has a lot of silent areas, and a lot of areas are not utilized like they say 10% of your brain is utilized,
Yeah.
and that's too much, you know, and that's the maximum in the whole animal kingdom. So imagine the 90% of your brain is untapped. So there were some movies made, like this was a movie called Limitless, and there was in Netflix. You
Yeah.
can see that there's a series, TV series. It's called Limitless. So what the idea was how to tap the silent areas.
I
So it started with the concept for the people who had too much dormant area in the brain and they could not do much activities or much things in life, and they were having some other neurological problems. So they started doing a neurosurgery and putting a stimulator in your deep side of the brain, and then put a wire and put a pacemaker in under your skin that's used to stimulate your deep brain. And that was a surgery given to a lot of different neurological, and then they found that is very good for psychiatric reasons too. But the problem with that is a very invasive, lot of complication, and it is very costly. It costed a couple of $1 million.
Jeez.
And it was frankly limited to only very, very extreme cases.
I see.
So you need to have whole neurosurgery, operation room and everything. Then there was around 25 years back, they discovered that the same results could be achieved by stimulating your deeper area of the brain by magnetic field. Now, I want to very clear about it. It has nothing to do with like ECT treatment, like you see in draconian movies, like people are being shocked and all that.
Movies? When I was in medical school, we went to the psychiatric ward and they were giving this electroconvulsive therapy.
Yes, and it is completely stepping out of that. So I want to make it very clear, there's nothing electric about it. There is nothing convulsive treatment in it. There's no ECT, no shock treatment in this. That's very, very clear. So the whole transcranial magnetic stimulation means, like I'm wearing the watch and there is a magnetic field in this. We live in a magnetic field, north and south pole, and our computers have magnetism, our cell have a magnetic field. Same way, our body is run by a magnetic field. So what happens is that through the magnetic field, through the significant magnetic stimulation, we penetrate deep in the brain and increase that magnetic field over there, and increase the circulation, increase the blood flow, increase the growth factors, create neurogenesis. As you know, next frontier of healthcare is neurogenesis. So they discovered that the brain, the people's lives is completely transformed.
So
like the people who had Parkinson's or stroke, they could do phenomenal things which they couldn't do before. So they discovered, why not apply it to other conditions? So this technology started around 25 years ago, and it came into US. It was FDA approved in 2006, to my knowledge, around 10 years back. But the problem is, all these years, the insurances would not cover it at all, you know, and it was unaffordable. So coming back to that, transcranial magnetic stimulation is in simplistic term, putting a magnet on top of your head and stimulating your deeper area of the brain without any side effect, without any complication.
No needles,
no penetration,
electrodes and
no electrodes, no invasion,
so
nothing.
you're getting the same effect.
Yes, and they could get better effects actually
I see,
than that treatment in which you have to do neurosurgery. So, and the beauty of it is that you can
move around here.
You can go anywhere. Exactly.
That's the beauty, because it's just outside the brain.
Yes, you can magnetic stimulation. You can pick up what the salient areas are and then stimulate. So it's even less invasive than, sorry to say, but EKG, you have to put electrodes and everything. It's not even that invasive.
The worst part of EKG is when you yank that electrodes, some of them are ready to slap on my cheek.
So it is less invasive than that.
I've used words too. I guess in that way it's much easier.
Yeah.
Ladies and gentlemen, you are watching Triple N Talk Show. I'm Dr. Nick Nickham, and my special guest is Dr. Ashok Jain, a psychiatrist, and we are talking about transcranial magnetic stimulation of the brain. I was going to say heart.
In fact, it is used for different organs, for neuropathy
Yeah.
and all that. So, because basically the technology is the same. And I'm
So
coming-
is this transferring energy into a particular focus point?
Absolutely.
Yeah.
That's the whole idea. See, they have kind of reverse engineered the technology. So initially, as we all are aware about MRI,
Yeah.
magnetic resonance imaging.
Yes.
So it was much better than CT scan.
Yeah.
Because in CAT scan, there was a lot of exposure to the X-rays and
That's-
it was
yeah.
very harmful to the body. So they came up with completely harmless. You can have 100 MRIs
Yeah.
of your head without any problem. So the MRI is, what they do is that stimulate the particular tissue. It could be anywhere, brain,
that's-
leg,
yeah.
anywhere. And then that tissue, when stimulated, radiates energy back. What it got from magnetic stimulation, and you record that.
Oh, I
and
see.
that's how you do diagnostic imaging.
So it's the reverse of that.
It's reverse of that. It's you are
You're
giving the energy.
transmitting energy.
Yes, and you're stimulating that area for continuous basis to make it more energetic.
Yeah. So what kind of patients would be candidates for this transcutaneous magnetic stimulation?
Well, first of all, transcranial. I used to get transcutaneous too. Sorry to correct you. And it is, it takes time to get a knack of it.
Yeah.
So transcranial magnetic stimulation, in Europe, when it started, has now been phenomenal, and it has been used in all across. It has been used in post-stroke patients, because when you think about it, in a stroke area, the one area is dead, but around the area is ischemic, meaning that
yeah.
is less blood flow, right?
Yeah.
And when they stimulate through that, they increase the blood flow in that area. So it has been researched and proven in post-stroke patients. Parkinson's disease is a huge one. Tremors is a huge one. In USA, it is FDA approved for depression, major depressive disorder, and that was a main condition it was applied.
So
yes.
in a stroke patient, so can we theoretically actually bring back some muscle function?
That's exactly how, in fact, I will tell you my personal experience. Recently, last month, I gave it a patient and she could not move her hand at all.
Oh.
Her hand was paralyzed for 8 years and she could not, because of some possible Parkinson-like effects or something. So she could not move her hand. So we gave her only one session, and I still feel thrilled to talk about that. And this was not for that. It was for other condition.
Yeah.
And she came in few days, and she came with her parents. This is 35-year-old Caucasian lady. And she was so thrilled, and she said, Dr. Jain. I said, what happened? She said, look at that. And first I could not understand what she meant by that. But she said, look, I could not raise my hand for 8 years. But this one session increased the blood flow so much to that my brain tissue, she didn't say in that terms, but that was the theory, was that it increased and she could raise her hand from there, and her pain level, which was 10, went to 2. So I have seen a lot of transformations when you, again, going back to the limitless, when you tap in the deeper areas of the brain and you activate and get more things, neurons involved,
Nerve
you're getting
cells.
more and more nerves active.
Yeah.
That's what happens. Because traditionally what happens is some of our brain areas are sleeping. They don't want to, they are conditioned to sleep and only use when only crisis comes or something.
So you're telling we got a lazy brain. Only 90%.
90% of the brain
90% of
wants
it
to
is
stay
lazy. It doesn't want to do anything.
Or sometimes it is different portions take over.
So in other words, a nerve cell that was controlling the action of these muscles in the arm, if it dies from a stroke, you can stimulate the surrounding nerve cells to take over the function.
Actually, that is how it was discovered. It
see.
was interesting. They were talking in a big auditorium in a big international conference in Europe, and they put this magnetic coil, because magnetic coil was used for something different, and they said, let's see whether it works on the brain also. So they put the brain and give a impulse, and the arm moved immediately. So because the cortical area was stimulated, right? So when that stimulated that cortical particular area, that area moved. So that meant that it's a direct stimulating that area of the brain. And that's how they came with the idea. Let's activate those areas of the brain which are sleeping. And unfortunately, as we know, now we know well research that a lot of these conditions, psychiatric as well as neurological as well as medical conditions, are because there is a chemical imbalance in our brain. Some of our brain areas goes to hibernation. They should be active, but they are not active. So what happens? We get all these diseases. This new technology activates, as is a new addition, without any harmful effect, without any radiation, without any shock treatment. It makes it active again.
Ladies and gentlemen, you are watching Triple N Talk Show. I am Dr. Nick Nickham, and my special guest is Dr. Ashok Jain. We are talking about transcutaneous, let me correct myself, transcutaneous magnetic stimulation of the brain to activate dormant neurons or the nerve cells.
So well put.
And okay, let's talk about what are the conditions could it be useful?
It can be useful, like I said, like there are limited FDA approved conditions, but like it's activating the brain. So I have seen let me step back and say what research has been done and shown advantage of. It has shown advantage in Parkinson's, for major depression, for anxiety disorder, for ADHD, for chronic pain is a big indication. A lot of pain centers in Europe, every pain center, they have a lot of this TMS, because what it does, it resets your brain for the pain threshold. Believe it or not, obesity, because it resets your hunger center. So you have less craving, you know. And chronic fatigue syndrome, chronic fibromyalgia. So basically all neurological conditions, Parkinson's, strokes, lowering the seizure threshold, these all are shown very hugely beneficial with this thing. Actually, there was one research which said that by stimulating the brain, you can get your childhood memories out also. I was shocked by that.
I got an academic question here, and I'm studying for MBA.
Yes, sir.
Can I get part of my brain stimulated so I can stuff all those MBA questions?
Absolutely. You can tap the potential technically, theoretically.
Yes.
Absolutely. I mean, I can tell you one. I had a engineer from a very big engineering firm in Sugar Land. He come to me, 57-year-old, and comes. He was bed confined. He was earning $170,000 for 6 months. He was bed confined, incontinent urine, and his kids were living in Austin, so they were very worried. And he was diagnosed with advanced dementia. And this happened over 1 year period. And they brought him to me, and the question was, Dr. Jain, where can we place him in a nursing home? And that was what they advised. And I looked at him, I evaluated him, did a thorough evaluation. And after 1 hour, I said, you know what? He doesn't have dementia. They were shocked because they had 3 specialists who told them that. He had something called pseudo-dementia. So we started him the treatment, and this TMS treatment just started coming that time in IB Broad, Sugar Land. And after 20 sessions, now usually the limit is 36 sessions. After 20 sessions, this gentleman completely transformed. He was, after 20 sessions, standing outside my center and saying, Dr. Jain, I cannot believe how good I am feeling. This guy was having brain shutdown, and we activated the brain. And within 3 months, he joined back the job. He is earning the same salary. He is independent, and his life was back. So that kind of results thrill me, to get these things to the common people, which you don't have to spend $30,000, which people used to spend.
That's
actually
amazing.
People did spend. When I was not taking insurances a long time back, we had people who spent $30,000-$40,000 to get the whole sessions, you know. But now it is almost negligible cost.
Okay, let's talk about the whole treatment itself. I mean, how long is a session, and how many sessions they need, and most importantly, what is the cost?
Yes. So first, usually the course is for 36 sessions. And in ideal setting, you do the session every day. So during the first session, a patient comes and we determine what areas to stimulate, particular areas to we pick up the areas computer tells us, and we look at it differently and analyze it too. So that is a little bit more labor intensive. After first session, when we pick up what areas to stimulate, that is the areas we can continue. Then we pick up particular frequency of magnetic strength we want to pick up, how deep we want to go in the brain. So we start the session. Usually if a patient can afford time wise, can afford to come every day, the ideal is come 5 to 6 days a week and get 36 sessions back to back. But if some patient cannot come, I have patient coming from Fort Worth, coming from Corpus Christi, from Lake Jackson, from different areas.
Yeah.
So what they do is, then we give it, scatter it. We give it 2 sessions a week or 3 sessions a week, and then we lengthen the treatment program. The important thing is that, like almost all the programs who are in Houston and other part of the nation are doing self-pay only. They don't take insurance. So we change our model.
I see.
And I said, you know what, my patient deserve better.
Yeah.
I have a family. Their family deserves better. So we started talking to insurance company, and we were very surprised that insurance companies were willing to pay. Now they paid like a hugely fraction. Like we used to charge and the other doctors used to charge $1,500 per session. So imagine 36 sessions. That is very costly. And other doctors, believe it or not, still have medical loan officers sitting in their office because they want to be paid upfront. So they have a medical loan officer and says, okay, you have $30,000 loan or $20,000 loan, medical loan, and to get this treatment.
Okay.
And we said, no, nothing doing. We don't want to have hardship on that. Patients should. So we started negotiating with insurance. Now, instead of $1,500, they may pay us $200 only or even less. But at least our patient can get it, So the affordability is a huge factor now.
That's right,
that's why we are getting a lot of it. We just barely cut our cost, but at least our patient can benefit from that.
True,
That's the most important. So each session, when you do is last for around 37 minutes, or half an hour, depending on the frequency. And this lasts for as much frequency you want, up till 36 sessions. And we do get insurance to get it covered.
That's fascinating. Ladies and gentlemen, you have been watching Triple N Talk Show. I am Dr. Nick Nickham, and my special guest is Dr. Ashok Jain, a practicing psychiatrist here in the Sugar Land area, and we have been talking about transcutaneous magnetic stimulation, and you can contact his office. Okay, let's give out your contact information again. If somebody wants to get more information, or if they want to set up an appointment to see what the benefits are.
So you can say Dr. Jain, Jain, in Sugar Land. If you type TMS, then there will be a lot of site, not a lot of sites. Some site in one site will pop up in Sugar Land. They are private pay only, but our site will pop up too. So just make sure that, because other places do not accept insurances. So you can Google my name, Dr. Jain in Sugar Land, or Psychiatric Solutions in Sugar Land, or Psychiatric Services in Sugar Land, and you can see Dr. Jain's our website, and you can see TMS, and you can set up appointment right on the website, or you can call our office at 281-302-6636, 281-302-6636, or you can file an inquiry or email us online, and we will get you promptly. We will get you quick appointment. Like I said, we are the only one with the largest TMS practice in whole Texas, and we are one of the very, very few whole Texas who accept insurances. So this is a life-changing technology. If your family member has significant psychiatric or neurological problem, do ask for a evaluation, and then we can tell you whether TMS will be helpful for your family or you or not. Please understand, it's a completely non-medicinal, non-invasive treatment. There's no shock involved. It's only a magnetic stimulation with lot of good results. So with that, I will say that Please try it out or ask us, and we will love to answer any questions you have.
Dr. Ashok Jain, it's been a pleasure talking
Thank
to
you very much.
and we will see you again.
Thank you very much for
Ladies
having
and
us.
gentlemen, you have been watching a Triple N talk show. I am Dr. Nick Nickham, and we will see you next time.